All right, we're live.
I have no idea what we're talking about.
Today,
you're going to do a surprise talk and put me on the line here.
Today we're going to do Ask Dr. Carey. I'm going to give some rapid fire questions and put Dr. Carey on the spot, see what he knows.
Cookie, is that the answer to everything?
Cookie is the answer.
Okay, cool.
First one is, since we got Rupert here, can animals be adjusted?
Yes, they can. Actually, in different states, there's different rules as far as animal adjusting. Like here in Maryland, you can adjust animals, but only in the presence of a veterinarian. But as far as can they physically be adjusted? Yes, animals have spines. And in nature, animals don't really need to be adjusted. It's a matter of for some reason, when we domesticate animals, they have deterioration of their organs. They're more prone to cancers and tumors and more prone to subluxations. Also partly because in captivity we put saddles on them or we put leashes on them and we pull and we yank at their neck. So yes, the answer is very easily, and all our pets have been adjusted all our life. Cool.
Next one. A lot of people ask this, what's the perfect pillow or the perfect mattress?
I just had a patient ask me this right before you were out at the gym. So my answer, and this is cheating, my answer for the perfect mattress is simple. Everyone is different. I can't tell you. I'm not a mattress salesperson. I'm a chiropractor. You want to get a good mattress, you go to a mattress place. But a good way to cheat is, I found if you go to the Sleep Numbers, and they have these beds that actually measure your pressure points. Now, everyone is different, so you want the bed with the least amount of pressure points on your back. So that's my answer there. I'm not going to put a name out for any of them, but the Sleep Numbers bed can help you decide if you want soft, firm, or hard. Pillows, again, everything is different, and the Sleep Numbers have tons of pillows that you can try. And what the idea is, you want your pillow when you're laying down not to be pushed up too high or not to switch down too low. It wants to be level. So level with yourself while you're lying on your side. That's my answer for pillows.
Can chiropractic help with skin problems like eczema, acne, things like that?
Well, let me ask you a question. What is the largest organ in your body?
Your skin.
Yeah. So what controls the skin and tells the skin how to respond to everything around it?
The brain.
And what connects the brain to the skin?
Spine.
And the nerves. So, yes, if there's nerves that go to it, chiropractic adjustment can affect it. So, if there's eczema, if there's any types of psoriasis, if there's weeping wounds that won't heal, 9 times out of 10, there is a subluxation going to that level. So, my answer is simply yes.
Okay. And what is a story of a condition that you helped that you never thought you would be able to help this patient when they first came in? They didn't think you could help them, and after coming to see you, saw results.
Chiropractic doesn't help with any condition at all, period. We do one simple thing. We find and we correct the subluxation. What the brain and the body does with that information is up to the brain and the body. I myself do not focus on symptoms, so if you come in my office, I'm not going to focus on your symptom. I'm going to focus on finding the subluxation, adjusting it, leaving alone. But I have actually, and I love saying it this way, I've gotten many women pregnant. If you know me, you'll know why we are both laughing profusely. I have seen many people's, literally, the proverbial attitude adjustment. They were very quiet, distraught, angry people whose total mentality has changed. And I like to call that, the tiger and the mouse syndrome, where that thorn, that constant nerve irritation and aggravation has been taken away and has calmed their system. I have seen people with eczema clear up. I've seen people that were amenorrhea and thought they had a mass tumor in their ovaries and their uterus, and an adjustment have seen the blood clots that were in there to be released and flowed through. So there's no specific thing. It's really whatever the brain and the body needs to do as far as communicating at its 100%. Hence the name of our clinic, Chiro 100, because we're somewhere between 100% life and 100% death. So that's a long, drawn-out answer to a simple question. All conditions are chiropractic conditions. There.
And last one is, of all the vertebrae on the spine, which one do you see the most where there are subluxations? Where are you finding the most commonality with all the patients?
Well, the most severe, most normal, the most one that I focus on the most, if you look up on the wall, is the C1 subluxation. If that bone is subluxated, it affects everything from the brain out. But if you go a little further, they're called transition segments. So C7 to T1, T12 to L5, L5 to S1. These segments where the facets, the joints that connect the bones to the ones above it and below it are slightly off and different than the ones that are directly above it or below it, because they are segments that change from rotation or bending and flexion and rotation. These joints tend to be used and irritated the most. So normally in that area, T6 a lot of times for some reason, but that's the easy one. You just ask the person if they have heartburn or indigestion. So C1, always the most important bone in the body, but I am a full spine chiropractor, so I adjust everything. But there's my answer for that one.
And then if people have questions, how do
Sure.
they get in touch with us?
It's simple. Patrick, what's our phone number? I don't call it. Call us at 443-966-5411. We're located in the Gold Coast Mall in what is now called Coastal Fitness, formerly known as the Gold Coast Gym. And we accept new patients on Tuesdays between the hours of 8 and 1. So just call. Those spaces fill up fast. Again, that number is 443-966-5411. And we'll type this in the comments area afterwards for you.
That's it.
Great. So as always, and I like to say thank you, and give us a call, and we're always here for you, and hopefully we'll see you again next Wednesday. Take care. Bye.